Okay, so this semester we did all of our work on phototherapy used in neonates with hyperbilirubinemia by myself, Cindy Etchers, Mary Feldman, Avery Mooring, and Taylor Whitehead.
Our PICO question for this project read, among term neonates with hyperbilirubinemia, what is the effect of phototherapy on prevention of severe complications in the United States? So hyperbilirubinemia in neonates is often treated with phototherapy, and too much bilirubin in the blood is a problem that can occur in the first days of delivery. And this could result in long-term damage in the neonate if left without treatment. And the goal of phototherapy is to reverse and decrease any increased levels in the blood. And so the purpose of our research was to determine the effectiveness and pinpoint the best interventions and the evidence-based practice that decreases and prevents any severe complications in the newborns. We felt that this was a really important topic to look into and to dive deeper in. Our PICO question is very detailed and narrowed, but like I said, our goal was to determine and evaluate a summary of results that best match our intentions of discovering what that best practice was.
Okay, so for the literature review, we searched keywords like neonates, hyperbilirubinemia, and interventions. The total amount of articles that came up were 240, and the database that we used to search was Kindhill. The inclusive criteria that we used were like United States residents and full term neonates. The exclusive criteria that we looked to exclude are preterm neonates, which is classified as being born before 37 weeks gestation, and neonates with other complications aside from hyperbilirubinemia.
For the 5 articles that we selected these articles because they matched our PICO question as best as possible for the small amount of articles that were presented in the literature search. They provided support for our research question, and then they also met the criteria of our study.
Okay, so the first article we looked into had 2 authors, and it was written in 2021, so pretty up to date information. The strengths were that the problem statement was effectively identified. It had IRB approval. There were sufficient number of sources that were provided, and 15 out of the 20 of them were within a 10-year publication date, and the author openly stated the limitations to the study, which was another strength. The weaknesses that we came across were that there was no hypothesis state provided. The convenience sample posed a risk of selection threat. There was a small sample size leading to a type 2 error. It was a non-experimental retrospective study, which has the lowest level of evidence. There was no operational definition. There was several confounding variables, and the samples were limited to only one institution.
The second article that we selected was published in 2017. There were, again, many strengths and many weaknesses for this article. For the strengths, there was an adequate amount of sources presented for this article, which was 13. The authors identified a clear purpose statement of the study. The nurses in the study were required to complete a clinical competency questions, and that was to make sure the nurses knew the risk factors and the causes of hyperbilirubinemia in order to adequately implement the study. The gender ratio for the sample was nearly equal, so there was an equal amount of male and females selected from the sample. The hypothesis was clearly stated. The patient identifiers were not attached to any data collection methods, so that eliminated any risk for the neonates. The project design was pre and post implementational study so that you could clearly see the effects of the implementation. There was consistent exclusion criteria for samples. The results were clearly stated and even described with tables, and the author addressed limitations to the studies. For weaknesses, 8 out of the 13 sources are not within 10 years of the article's publication date, so they were outdated. The study was also a retrospective quasi-experimental study. The samples were limited to a single hospital, so it made it hard to draw conclusions on a greater population. The limitations that the author stated were changes in nursery providers from 2011 to 2012, inadequate equipment available to treat with phototherapy, hesitation of pediatricians to follow the AAP hyperbilirubinemia CPG. There was a small sample size. The study used inferential statistics. There was no IRB oversight, and the framework used to conduct the study is considered outdated.
The third article we chose was written in 2023, which is very dated. It came with some strengths, like it states the confounding variables. The author openly states the limitations to the study. It states inclusion and exclusion criteria. It received IRB approval, which we know is safety. It has a purpose statement. Authors have no potential conflict of interest in this study, which is a good thing. There was a comparison groups. Clear results were stated, and the funding is stated and was from a good source. Some weaknesses that we found were that the sample size was too small, only 359 neonates. It was a retrospective study. There was limitations to the study. No hypothesis statement was presented. Confounding variables were present. Newborns only looked at from a single center, so it can't show the wide variety of population. The user dependent study, it was not well documented, and this is because they had at home phototherapy that was like documented by the parents, so it's not the best source to be documenting, and the sources are outdated, and the conclusion statement was weak.
Article 4 was published in 2020, and some identifiable strengths were that they minimized bias with a randomized, non-blinded clinical trial. They also stated their hypothesis, and clear results were stated. In the study, they used verbal and written informed consent, and this was obtained by the parents of the newborns to be able to complete the study. Confidence intervals were presented clearly, and intervention was properly implemented and described, those confounding variables. And then sample was adequately described. Study results in meaningful evidence to decrease side effects, minimize and reduce. So the study results were clear of that meaningful evidence. Some identifiable weaknesses were that the sample sizes were really small and unequal. The limitations and just barriers in the study were not stated in the article. Of the 24 references, about 11 of them or only 11 of them were within that 10-year of the published study. And then 4 of the newborns of that small sample size were dropped out of the study, 2 of them being from communication issues. So that was definitely a weakness, regardless of there being a huge number of members that dropped out with that small sample size. It did show that clear weakness. Only one method was used to collect the data with the 2 different light strengths. So one being at 478 nanometers and the other at 459. So there was no triangulation. And the last weakness was the lack of thick description in the conclusion.
Okay, so the 5th article was from 2021, so pretty recent. The strengths that were evident were there was a purpose statement and it was presented clearly and it was obvious. They clearly state which group was the experimental group and which group was the control group. All forms of the measurement for the level of irradiance in the surface area exposed to the phototherapy are standardized, so they were the same across the 3 studies that this article was talking about. And the treatment time was also standardized at 24 hours for all 3 studies. There was a follow-up on all 3 previous studies, so the results were congruent for all 3, and the results were standardized into clinical practice. There were randomized participants in each individual study. It clearly states the clinical significance. There were ideal ratios and nanometers were clearly stated. It states its limitations. All 3 studies were done in the same neonatal department. It was an experimental prospective study, and findings were effectively summarized. The weaknesses that were evident was there was no hypothesis clearly stated. Small sample sizes for each group. There were different lamps used in the first study compared to the second and third one, just because they weren't using LED in 2007 when the first study was being conducted. The participants of the first study were different from those of the second and the third study. There was a 15-year gap between the 3 studies, so there was a change in the policy of how hyperbilirubinemia was treated. IRB approval was not presented. The sources were not presented. The overview of the 3 studies, it's not its own study, and the data presentation was confusing and hard to read.
Okay, so now we are going to be summarizing the overall results. Starting with Article 1, the purpose of the study was to see different effects of different combination phototherapy treatment. The results of the study showed that dual blanket therapy resulted in a more rapid decline of TSB. The sizes of the groups were uneven, which could have skewed the data, leading to non-significant findings.
For Article 2, the purpose of the study was to implement and evaluate the impact of adopting the American Academy of Pediatrics hyperbilirubinemia clinical practice guidelines in a newborn nursery. And implementation of these guidelines resulted in a significant increase in appropriate phototherapy use, a significant decrease in the number of TSBs obtained on newborns, decreased lab costs, nursing time, and improved newborn care was also noted in this study.
For Article 3, the results of the study stated that home phototherapy is potentially effective in reducing the risk of readmission for neonates who had jaundice. The main impact they were hoping to see is a decrease in readmission for neonates that had hyperbilirubinemia. The study stated, though, that it did need more data to draw statistically significant results. So there would just need to be more studies done to actually hopefully implement this into clinical practice.
Article number 4 resulted their study in meaningful evidence to that decreased the side effects, minimized and reducing them when the LED light centered at 478 nanometers should be used rather than 459. So they just focused on the same machine, but just at different strengths. And so the suggested strength of this therapy wasn't but with the two small groups, the results had highly significant evidence. And so both groups saw a decrease in serum bilirubin, but just with that 478, just with that greater confidence interval. And this resulted in enough evidence, even though it was small evidence or a small difference to make that evidence practice change. The bigger sample size could have provided more meaningful results with a larger group studying those two different strengths.
In the fifth article, the goal of this article was to sum up the results of 3 previous studies conducted over a total of 15 years. This study was comparing the difference in a decline of TSB over 24 hours with the use of blue-green light and blue light. The results showed that an irradiance level of 478 nanometers is ideal for a rapid decrease in TSB. All groups involved showed decreases, but the one that was set at 478 nanometers over 24 hours decreased more than the others. And because of this, the results of these 3 studies have been normalized. So clinical implications for nursing practice. The first 4 articles that we presented to you were the low quality studies, and then the 5th article was a high quality study. So with these 5, all the results found in the low quality studies were congruent and or similar to the results found in the high quality article. And then the reason that they're different is because the low quality articles were done in settings that were small and confined, and they also had limited amount of participants. There were also a lot of limitations in the 4 articles that kind of could have skewed the results, especially the first one. And then the high quality article was an accumulation of the results of 3 studies that were conducted over 15 years with different participants in each study. And as a result of this, the results from the high quality study were normalized and were implemented into clinical practice. So that's why we considered it the high quality study. And then here are references, and that's it.